right, it's 12:30. Let's get started. Good afternoon, everyone. I'm Hartford HealthCare's Tina Verona. Thank you so much for joining us for this media briefing. We are going to be talking, giving you an update on universal vaccines as well as boosters and COVID-19 testing on how that's all going. We encourage you to write your questions in the chat so that we can ask them in order of our experts today. And I'm really happy to be joined by Dr. Ajay Kumar, our Chief Clinical Officer for Hartford HealthCare, and alongside him, Dr. Jim Cardon, our Chief Clinical Integration Officer for Hartford HealthCare. So Ajay, do you want to take it away with some opening remarks?
Thank you, Tina. Let me start with reminding us, all of us, that we are still in the middle of the pandemic and we still have 97 individuals admitted to Hartford HealthCare in acute facility. Hartford Hospital continues to have a high volume, 37 patients today. The second busiest hospital in terms of COVID right now is a hospital center, Connecticut, with 22 patients. And then we have 16 patients in Bacchus Hospital, 8 in Mid-State Medical Center, and St. Vincent has 6 patients, and Wyndham has 1 patient at this time. Wyndham has 4 patients, I'm sorry, at this time. So, you know, as we watch the pandemic, we have seen the numbers come down in terms of positivity in the community, but however, we're still seeing those individuals who are largely unvaccinated coming to the hospital. Now, vaccine has become one of the mainstay of preventing mortality and death, and we are so proud in Hartford HealthCare that how well our colleagues have embraced during this vaccine mandate. I know many of you are looking forward to knowing the numbers, but let me start with, before the numbers, what the effort many individuals across the Hartford HealthCare has placed to educate, to provide information through our call center, through one-on-one reach out, through our managers working closely with our colleagues. And I'm really proud that over 99% of the Hartford HealthCare colleagues have embraced to stay in healthcare, to embrace the medicine, vaccination, and to obviously take the side of safety and precautions at this time. Now, in Hartford HealthCare, we have 34,000 colleagues who actually work within the ecosystem. That includes our medical staff, includes our other contracted individuals, and 27,373 employees who actually are on direct payroll of the Hartford HealthCare. Now, let me start with the medical staff. I think it's really important to recognize how the physicians and advanced practitioners came together across the system. Out of 4,000 plus medical staff, which are physicians and advanced practitioners who work across the Hartford HealthCare, in behavioral health, community network, in our acute hospital, in our medical group, ambulatory setting, we have 99.8% acceptance of the vaccination. Those individuals who have not received the vaccinations are generally occasional workers or have decided not to pursue further work in Hartford HealthCare environment. It's really important to note that all our elected physician officials across the system have come together to support this vaccine mandate. So I think I just want to stress one more point. The physicians and advanced practitioners have a significant, have been absolutely very much behind the vaccine at this time here. Within the colleagues in Hartford HealthCare, we have 176 colleagues as of today who are on suspension, who are still in the period when they may decide to take the vaccination. Otherwise, they would be choosing a different type of career, at least in healthcare for Hartford HealthCare in future. And we have connected with them one-on-one and respectfully communicated our goals regarding the vaccine mandate. The 176 individuals across a system of 26,373 is a remarkable solidarity of our healthcare workers behind the vaccination. Now, we do have some individuals who have received 1 dose only and who are due for 2nd dose, but I'm hoping those individuals will finally, when the time comes, will take the 2nd dose and will be okay. Now, in terms of exemptions, Hartford HealthCare obviously has seen increased amount of exemption requests compared to flu or any other in past we have seen. We expected that to happen, this phenomena at this time. And as of today, we have 877 individuals who are exempted, who are going to go through the weekly testing protocol. And all these exemptions are reviewed by our independent committees for the religious or medical, or many of them postponement because of pregnancy and other related issues as well. They're not true exemption, they're postponement where the individuals will eventually qualify for vaccination. So, really important is stress and highlight the effort our teams have provided. Focus on education, focus on compassionate and humanistic way of approaching the choice people are making at this time. And we have done a remarkable job in Hartford HealthCare in getting to the vaccine mandate numbers where we are right now. I couldn't be more proud of our colleagues across the system. And I think this is a testament of who we are as a Hartford HealthCare, a compassionate, humanistic organization who meets people where they are and engage them in education and tries to get them in the right place for the safety. This should solidify our commitment in the community one more time in terms of how safe the Hartford HealthCare is, how safety is the highest priority for us. So I'm hoping, I know many of you have been waiting for numbers to come, and these are the numbers as of today. And hopefully in next several days, I might be able to report even lesser number of individuals who may decide not to be with the Hartford HealthCare. So after that, I think I'm going to pass it back to Tina or Dr. Cardon.
Yes, thank you, Dr. Kumar, for those updated numbers. And before we get to the questions, we have a lot of questions in the chat, but Dr. Cardon, do you want to just give us an update on COVID-19 testing and how that's going?
Sure, happy to do that. So at present, as all of you are aware, we have continued to watch positivity rate and demand to try and gauge the access to testing and whether and how much we need to expand. There's significantly more testing going on in the environment between non-HHC, so between the Semaphore labs, Quest providing access, as well as others. And we've continued to provide access to testing in both our Go Health sites, our offices for patients that would meet there, as well as the Newington, which was particularly set up to care for those with symptoms, since that is more difficult to test. Quest does not have capacity to test symptomatic patients at the moment, and we are preparing for and understanding that as we get into the winter months, need capacity to make sure people with symptoms have an ability to, both exclude or include COVID, but importantly, look across, flu and other respiratory viruses that we need to be aware of. As we've continued to see, our volumes are testing somewhere in the 8,000 to 9,000 per week. Positivity rate, we run a little higher than the state average, which is about 1.9% right now. But that's because of we see more symptomatic folks in the hospital and otherwise that drive those numbers up. And they've always been higher than the daily prevalence kind of numbers you see. At our drive-through, we have the capacity. They are currently open in Newington at 3 days a week, 8 hours each of those days. We have the capacity to do about 64 tests a day. That will be expanding per plan to 96 per day to next week. It just anticipating some increased demand, although we continue to have open appointments and a not insignificant no-show rate of about 20%. So we certainly aren't seeing pressure that people are struggling to get testing. Every once in a while, people just don't know where to turn. And so I think that we continue to strive to do a better job of making sure everybody knows the availability. And as always, going to our COVID testing website, HHC COVID testing, provides a great deal of detail and an ability to schedule those appointments if that's the easier way for you to go. So overall, as far as we can tell at the moment, we have plenty of availability, but we will continue to monitor that and expand both in terms of hours at the Newington, but more importantly, into additional regions should we see that we're seeing a real need to increase our capacity.
Great. Dr. Cardon, thank you for that update. And I know that we've seen us having to be agile throughout this whole thing, and we will continue to do that as the situation arises. We do have questions coming in. I want to make sure that we get to all of them. Dr. Kumar, I know you addressed some of the numbers surrounding medical and religious exemptions, but I do want to make sure I still ask the question from Brian Hellenbeck from the Day newspaper regarding the vaccination mandate for Hartford HealthCare employees. Can you provide the numbers of medical religious exemptions requested and the numbers of medical religious exemptions granted?
Brian, I don't have exact numbers, but I'll give you approximate because the numbers do change. We have about 1,300 exemption requests which came through approximately around that number. 56 to 57% of them have been religious in origin. Less than 10% are medical, and rest are postponement for pregnancy and other related issues. That's pretty much a broad number. And I think our teams have done a good job of assessing every single individual request appropriately.
Okay, thank you. Alex Putterman from the Hartford Current, he has first question. When is the final deadline for employees to get vaccinated to avoid termination?
That would be 14 days from 9:30. That will be 14th of October. That would be the date.
Our next question comes from Peter Yankowski from Hearst, Connecticut Media regarding boosters. Can you say what the process is at this point for anyone who qualifies? What should they bring to show they are eligible? Do they still need to make an appointment?
Dr. Cardon?
Yeah, sure. I'll be glad to take that. So I'll give you some sense of the rollout. We started with those that were immune compromised and did our outreach. We've seen a steady stream, but certainly not as robust as we may have intended. And our numbers look very much like what the state has seen, that somewhere around what we anticipated, 20–25% of the folks that we assumed would be coming in would actually be coming through the door. I think they will continue to proceed. Since it's been expanded for the Pfizer, we're doing about 3,000 vaccines a week, give or take around that, in terms of the uptake for the boosters vaccine for that. Again, plenty of capacity. You can walk up or create an appointment, your choice. The methodology can come right through the website as well, Hartford HealthCare COVID-19 vaccines. If we do not have a documentation of what your vaccine you had received, we ask that you bring documentation for what that is. We are adhering to just Pfizer and not cross-matching the different RNA virus vaccines. Second piece is that we do ask that you attest that you fit into the appropriate categories as you come through. That is part of the online check-in. And if you attest that you fit in the appropriate categories as defined by CDC, then you get your vaccine. So far, we've expanded capacity, had the ability to go further if we need to, but demand certainly, although is encouraging, has not been robust. I suspect many people are waiting to get their flu shot and COVID vaccine at the same time, don't feel that same sense of urgency. So I think we're going to see just a steady uptake of the vaccine, but somewhat more likely at patients' convenience than the need to get the vaccine when they were completely exposed at the beginning of this entire pandemic in our efforts.
Thanks, Dr. Cardon. Our next question comes from Erica Moser, also at the Day newspaper. Did Hartford HealthCare consider allowing employees with previous COVID-19 infection to opt out of its vaccine mandate? Why did Hartford HealthCare decide not to allow this? What is known at this point about the strength and longevity of natural immunity?
Thank you, Erica. I'll take that one. We did not exempt those individuals who had previous infections. And the reason is the science has shown that the natural immunity, although the numbers are slightly still being debated, but around 90 days to 120 days or so. And after that, the immunity wanes very quickly. The vaccines provides at this time one of the longest and most robust response, which has been studied very well. So vaccine still remains the best protection we have in terms of reducing mortality and hospitalization at this time.
Second question from Alex at the Hartford Current. Connecticut has the lowest level of new COVID cases of any U.S. state. What role do you think our high rate of vaccination plays in that statistic? What other factors might be at play?
I can start, and I will ask Dr. Cardon to add if I missed something. I think we have to be very proud of our state in how we have led our country at this time in terms of vaccination and creating strategies to prevent that. And I like to believe that Hartford HealthCare has played a significant role in educating and providing from the day one of the early times of the pandemic by opening a 24-hour call center, a variety of different type of resources, and access to the vaccination we provided. So I think our vaccination has played a significant role at this time in reducing at least the mortality and hospitalization we are seeing right now. But in terms of reducing the positivity, one of the things which I like to believe that Connecticut state has generally been a bit more compliant with mask and social distancing than many of the states in the country. I think we have to be, I'm really proud of our state and how we've managed the pandemic at this time. And I'm hoping we will continue to do so in the next several months when we still expect some kind of a smattering of COVID all the way till early part of the winter. Jim, anything else to add on to that if I missed something?
I think you captured it. The only thing that, and I have no evidence of this, but my hope is that, we knew that vaccinating a certain number of the population would help with this, but we were always worried there'd be pockets that were really under vaccinated substantially that could allow a disproportionate kind of continued bubbling of this event. And I do like to think that the focus the state made on trying to get into the communities that are typically underserved, and we and others really focused on that, may have had a little bit of an extra added benefit of quelching the spread of the virus. Hard to know for sure, but it certainly was a focus for all of us to try and make sure that we had no community left behind. And certainly for Hartford HealthCare, it was a top priority.
Our next question comes from WFSB Channel 3. Do you expect a booster anytime soon for Moderna? They are the only ones we haven't heard from.
I think there is a fair amount of data reviews going through FDA at this time, and we are hoping that by end of October, early November, we will hear some news about Moderna's booster approval. I think the information which is coming out from FDA is it comes in waves, and we haven't heard anything new than what you have not heard. So what I knew about in past was sometime in October. I would imagine late October, early November will be the timeline.
We have a second question from Erica Moser at the day. As COVID-19 becomes endemic, what is the way forward? How long might testing requirements last, and for how long will vaccinated people who test positive be required to isolate for 10 days? Will the COVID-19 response become more like the flu response, or will the flu response become more like the COVID-19 response?
Erica, it's a very complicated question you're asking.
Good one. It's a good question, but it's complicated.
Excellent question. So, our goal has been throughout the pandemic is to develop modalities and therapeutics and vaccinations to prevent suffering and mortality and hospitalization. And I like to believe we're getting there with vaccines and possible oral therapy coming out, the monoclonal antibodies, and the learnings we've had along the line with mask and social distancing has helped us reduce some of the mortalities at this time. Now, in future, one can expect that COVID-19 would be something like flu over time. And the future is difficult to predict. Probably sometime next year, I'm hoping, is that when we would be in a place where we would have some sort of oral therapy and other medications and vaccination widespread given to the individuals. So we will see a small or seasonal, possibly seasonal COVID-19 effect in future. So that's the best hope. And I think we've already seen the vaccination has definitely reduced the mortality significantly. Different type of therapies such as monoclonal antibodies will also contribute to reducing that, and other modalities we know so far from remdesivir and other medications we've been using will also contribute to that. So we have a bit more tools in our toolbox now than what we had 1.5 years ago. And next year we'll have hopefully a lot more tools. So this pandemic becomes a something like flu over time. And I hope I answered your question regarding the duration, how long this phase will continue. I think there's a lot of different type of modeling, and we at Hartford HealthCare, along with MIT, have been evaluating different type of modeling. We think at this time that hospitalization, what we are right now in the kind of a plateau state, will continue for at least 4 to 6 weeks at this time. And it's difficult to predict what will happen after that. because we are also seeing some increase in respiratory illnesses and flu-related illnesses right now. So we might actually have a different type of problem in the sense of increased respiratory infections in late winter, which might affect the hospitalization and capacity issues. So we're watching very carefully, and obviously we'll be out in front to manage whatever comes. I just want to reassure our community and our media and other members, the Hartford HealthCare has positioned itself through our secure and allotment of PPE, our education, our access points, our safety protocols, to be a very safe place. And we are committed to continues to provide the care the community deserves and needs at this time.
A question from Nick Rondinone from Hearst, Connecticut Media. I wanted to get your thoughts of the latest Pfizer-BioNTech news that the companies have sought FDA approval to administer the vaccine to children age 5 to 11. Also, how has the booster rollout been going for Hartford HealthCare?
I think Dr. Cardon already answered the questions regarding the booster rollout. Regarding the approval process for children age 5 and 11, I think we have to allow FDA to give its time and review the data and make a decision at this time here. I would not want to assume that I have the understanding on all the data. And I think let the work happen at the FDA level and decide what the next step is. From a societal standpoint, any vaccination we can provide to larger volume of our citizens is better for us. That reduces the chances of further outbreaks of infections and obviously creates a significant herd immunity. So if approval occurs, it's a positive sign, but we will have to wait and see what the FDA decides.
Our next question from Nicole Leonard, WNPR Public Radio. Dr. Kumar, does the 99.8% compliance rate among clinical staff also include those who have secured eligible exemptions, or is it specifically those who have been vaccinated?
Nicole, it does not include the exemptions among the medical staff. We have very small number of individuals, maybe about 10 or so, who have received the exemption among the medical staff. It does not include. I hope that answers your questions.
Follow-up question from Peter Yankowski, Hearst, Connecticut Media. For Dr. Cardon, CDC categories for workers include some specific jobs, but also says people should talk with their doctor about whether their job puts them at risk. If someone has concerns about whether their job puts them at risk, is there someone at Hartford HealthCare they can call, or should they just attest that they fall into the worker category?
Always able to call the CCC, our call line. That's what they're there for, to help answer questions for people who are confused or need guidance. And so that resource is available as we've had it through the pandemic. So that's always a good resource if their physician cannot guide them. Our intention is certainly, if you have concerns and you feel in a category and agreed it is somewhat vague, but our inclination is to administer vaccines to those who feel at risk and not to try and police that so much. So we tend to take a liberal view of people who say, gee, I think I qualify and I'd feel safer with a vaccine. As long as it's Pfizer and they have it and they're in the right time interval, that'll all happen. But the CCC is the place I would point people if they have questions.
I'd just like to stress that our website has a wealth of information and details as well. And I advise all the members to visit our website as well. And you should be able to find most of the answers to your questions.
Follow-up question from Eric at the Day newspaper. What should people do if they lose their vaccine record cards, and do you anticipate that proof of boosters may eventually be required for things like work and travel?
Erica is asking some real complicated questions today. Erica, if folks have lost their vaccine card, they can obviously secure one if there is evidence in our system that they have received the vaccination. However, we advise folks to really search and keep your vaccine card very carefully. As you know, we are concerned about duplications of multiple records as well. Regarding, do you anticipate the proof of boosters may eventually be required? It's difficult to tell. I don't suppose so at the moment, but I think we will know probably early next year what that state will look like. As you know, CDC and FDA has been somewhat cautious in presenting the booster guidance, and many of the mays or should be at the moment. So I don't anticipate there would be a firm requirement of booster proof in future.
And
I'd just like to add one other comment. I advise folks to get the boosters to prevent and protect themselves rather than worrying about the travel. Most important to stay alive.
one more question from Peter Yankowski, Hearst, Connecticut Media. If someone needs a booster, should they wait to get their flu shot or vice versa?
Doesn't matter. I'll take that. You can get them at the exact same time. So whatever's most convenient for you to get it. With flu, there's a timing around that as well, as everybody knows, because you don't want your immunity to wane while we're still in flu season. So, but from this point on, you're pretty much in good shape to get both if that's more convenient for you.
All right, that looks like all the questions that have come through our chat. Actually, nope, Nicole from WNPR Radio. If and when Pfizer's vaccine becomes authorized for kids 5 to 11, what role might pediatric offices play in that rollout, and how might it look different from how vaccines were first administered to older children and teens a couple of months ago?
I'll take that, Ajay, to start. We've been working with our pediatricians. I do think that as opposed to the mass vaccination sites and the sort of the way that we did it the first time, especially with parents and kids, young children, they're going to be looking to their pediatricians who are routinely responsible for their administration of vaccine to support that in a robust way. So we do see the pediatric offices needing to play an essential role. We are facilitating the storage and some of the complexity of the logistics around vaccine for our clinicians. They're and making sure that they're supporting them to make sure how and they can sign up and make sure that they can just do that. So we do think it's going to be important and different than adults.
Okay, that looks like all the questions in the chat. With just a couple of minutes left for final thoughts, Dr. Cardon, do you want to begin?
No, just appreciation. I also, I was thinking about a little bit more why we're doing better. And I do think the communication that you all provide and the constantly keeping this in front of people and the reminders to keep yourself safe and the reporting you do is an important part of educating the communities, which has really helped us blunt the impact. So I just want to appreciate what you do and continue to ensure that the communities are aware that we're not out of this yet. And the more we do to both protect ourselves and our neighbors and loved ones, the better off we're going to be.
Well said, Dr. Cardon. Thank you. Dr. Kumar, final thoughts?
I want to make sure Erica Moser does not have any further enlightening questions. Which doesn't seem to be the case. Well, I want to thank all the media and everybody else, as Jim said very well. It's really important to continue to pay attention to this pandemic. We have come a long way. We've done a good job. And I think we need to continue to not be complacent at the moment. We can't allow that to happen. And I encourage everybody who is not entirely sure about the vaccination, do reach out, do have a conversation before you make a decision. And I think where the Hartford HealthCare has managed this vaccine mandate, which is with a significant amount of empathy and compassion and connecting with people where they are and advising them and providing education, is the way to go. And we have done that very well. And I like everybody else to consider that same amount of conversation and communication, to seek the same amount of conversation and communication at this time. And hopefully people will make the right choice. Thank you.
Well said. Erica, by the way, is all set. So she thanks you. And Peter, thanks you for answering his boilerplate questions. So as always, thanks to our experts. Thank you to the members of the media who have joined us. We hope you found this valuable and useful, and we will continue to have media briefings as necessary. So as always, thanks for joining. And Dr. Kumar, Dr. Cardon, thank you.
Thank you.